The anterior triangle is a region located at the front of the neck. In this video, we are going to look at the borders, the contents, the subdivisions, and some clinical implications associated with this triangle. The anterior triangle is situated at the front of the neck. It is bounded superiorly, laterally, and medially. Superiorly by the inferior border of the mandible, known as the jawbone. Laterally by the anterior border of the sternocleidomastoid muscle. Medially by the sagittal line drawn down the midline of the neck. Investing fascia covers the roof of the triangle, while the visceral fascia covers the floor. It can be subdivided further into 4 triangles, which we'll look at in details. The contents of the anterior triangle include nerves, arteries, veins, lymph nodes, and muscles. The muscles in this part of the neck are divided as to where they lie in relation to the hyoid bone. The suprahyoid muscles are located superiorly to the hyoid bone, and the infrahyoid muscles located inferiorly to the hyoid bones. The suprahyoid muscles consist of the stylohyoid, the digastric, the mylohyoid, and the geniohyoid. The infrahyoid muscles comprise of omohyoid, stenohyoid, thyrohyoid, and stenothyroid. There are several important vascular structures within the anterior triangle. The common carotid artery bifurcates within the triangle into the external and internal carotid branches. The internal jugular veins can also be found within this area. It is responsible for venous drainage of the head and neck. A lot of cranial nerves are located in the anterior triangle. Some pass straight, and others give rise to branches which innervate some of the other structures within the triangle. The cranial nerves that are seen in the anterior triangle are the facial nerve, which is also known as the cranial nerve 7, the glossopharyngeal nerve, which is also known as the cranial nerve 9, the vagus nerve, which is also known as cranial nerve 10, the accessory nerve, which is also known as cranial nerve 11, and the hypoglossal nerve, which is the 12th cranial nerve. The anterior triangle is subdivided by the hyoid bone, the suprahyoid, and the infrahyoid muscles into 4 triangles. The triangles are the carotid triangle, the submental triangle, the submandibular triangle, and the muscular triangle. The carotid triangle of the neck has the following boundaries: the superior borders, the lateral border, and the inferior border. The superior border is bounded by the posterior belly of the digastric muscle, while the lateral border is bounded by the medial border of the sternocleidomastoid muscle, and the inferior border is bounded by the superior belly of the omohyoid muscle. The main contents of the carotid triangle are the common carotid artery, which bifurcates within the carotid triangle into the external and the internal carotid arteries, and the internal jugular vein, as well as the hypoglossal and the vagus nerves. The submandibular triangle is located underneath the body of the mandible. It contains the submandibular gland, which is a salivary gland, and lymph nodes. The facial artery and the vein also pass through this area. The boundaries of the submandibular gland are superior, anterior, and posterior. Superiorly, it is bounded by the bodies of the mandible. Anteriorly, it is bounded by the anterior belly of the digastric muscle, and posteriorly, it is bounded by the posterior belly of the digastric muscle. The muscular triangle is a triangle that is situated more inferiorly more than any of the subdivisions. It is a triangle in reality having 4 boundaries. The muscular triangle contains some muscles and organs, which are the infrahyoid muscles, the pharynx, the thyroid, and the parathyroid glands. The boundaries of the muscular triangle are superiorly by the hyoid bone, medially by the imaginary line of the neck, superiorlaterally by the superior belly of the omohyoid muscle, and inferiorly by the inferior portion of the sternocleidomastoid muscle. The clinical relevance of the anterior triangle of the neck is the medical uses of the carotid triangle. In the carotid triangle, many of the vessels and nerves are relatively superficial and so can be accessed by surgery. The carotid arteries, the internal jugular vein, the vagus and the hypoglossal nerves are frequent targets of this surgical approach. The carotid triangle also contains carotid sinus, which is a dilated portion of the common carotid and the internal carotid arteries. It contains specific sensory cells called baroreceptors. The baroreceptors detect stress as a measure of blood pressure. The hypoglossal nerve feeds this information to the brain, and then it is used to regulate blood pressure. In some people, the baroreceptors are hypersensitive to stress. In these patients, external pressure on the carotid sinus can cause slowing of the heart rate and a decrease in blood pressure. The brain becomes underperfused and brings about syncope. In such patients, shaking of the pulse at the carotid triangle is not advisable. Alright guys, I hope you found this video helpful. Please remember to subscribe, share and leave a comment, and also like the video for your algorithm. See you in the next video.